I got started when I retired from a practice that was about 60 hours a week. I stayed retired for 90 days and about went crazy. My wife said, if you don't get out and do something, one of us will shoot the other, and I don't intend to be a recipient. So I started some volunteer work.
Dr. Cooke is a retired rheumatologist, been involved with Crossover for over 10 years.
I made a horrible mistake in college. I took 4 years of German, never used it, and I've forgotten it all. I should have taken Spanish.
One of the funny things that Dr. Cooke does, which just really kind of cracks all of us up in the clinic, is he is not bilingual. So when we have a Hispanic patient that comes in that does not know English, the patient will be in the room and Dr. Cooke will walk in and he'll take one look and, do you speak English? And they'll say no. And he'll walk out and go, translator, translator.
One day we ran short of staff translators, and I went in to see an elderly lady who was accompanied by her granddaughter who was about 10 years old. We didn't get very far very fast with that conversation. Finally, the little girl said, I can help. So she did a beautiful job of translating for me. They left. The next person coming in spoke only Spanish, did not have a granddaughter with her, so I went to the waiting room, called the little girl in, come in here. I need some more help. She was very gracious. When we finished, I gave her $1 for it. You would have thought I was Santa Claus coming down the chimney in July.
Dr. Cooke has a unique combination of a country doctor with a great physician mind.
For all of his bigness and height, he is really a gentle person, and I think really embodies what it means to compassionately care for our patients. He is incredibly compassionate and incredibly patient with the folks. He listens to their stories. He lets them talk about where they're having pain and takes time with them, and I think they really appreciate that.
I enjoy it. Hopefully it will help people, but I suspect I'm the one who gets the most help from it simply by going and doing these things. My faith takes a role in this, in that we are told by the greatest physician of them all that we do have a responsibility to look after people who are less fortunate than we are, and you don't need to go 5,000 miles to do missionary work. You can do it right here in Richmond, Virginia.